My name is Everitt-Reynolds. I'm a lecturer in Dundalk Institute of Technology. I work mainly on the nursing, midwifery and health related studies programmes. My feedback challenge was related to the provision of feedback to first year students who are out on clinical placement. The aim of the feedback initiative was to provide our students while they were on placement with feedback that they could access timely. Prior to this, our students, while they were out on placements, couldn't access their feedback unless they came into the college. The feedback approach that we used would be Turnitin via Moodle. This allowed us to provide students with the feedback in an appropriate manner and in a timely manner, and they had been used to using Turnitin to look at their similarity index beforehand, so this was an added extra feature. We used elements of annotation within the text itself that students could access, and also where we gave an overview, a general comment. The students in particular found that being able to access the feedback on placement was very useful. The feedback was based on clinical practice, so it allowed them to consider how to reflect and review their practice so they could use it timely while they were on placement. They also found that the text annotation within the feedback that was provided was particularly useful because it was specific and not generic feedback that was provided to them. If we were to use this approach again, I would make a few changes. One of the changes I would make would be to include a rubric for students so that they could contemplate what was being assessed. And therefore make the feedback a bit more relevant. Maybe more information would be needed for students with regards to how to access this type of feedback in the future. The main tips I would have for any other lecturer who might want to use this mechanism to provide feedback would be to create a screencast showing students how to access their feedback. In particular, we found from the assessment of students using this mechanism, they found it difficult to access the text, the overall comment. So I think showing them how to access that would be of value to them.